Welcome to our channel. Today we're diving into an important topic that affects many new mothers: postpartum depression, or PPD. We're going to talk about what it is, what it looks like, and what you can do about it. Becoming a mom is a beautiful thing, a blessing, but it can also be a real roller coaster ride. Your body goes through massive changes, your hormones are doing the Texas two-step, and you're trying to adjust to this brand new human being who relies on you for everything. It's a lot, and sometimes that can lead to PPD. Postpartum depression doesn't just come out of nowhere. It's not a sign of weakness. It's a real medical condition. And like any medical condition, there are things that can make you more susceptible to it. One of the biggest factors is hormones. After you give birth, your estrogen and progesterone levels take a nosedive. I'm talking a plummet. And that can mess with your mood in a big way, but it's not just hormones. The stress of being a new parent, sleep deprivation, because, let's be honest, those little bundles of joy don't sleep through the night. And even just the adjustment to motherhood can contribute to PPD. And if you have a history of depression or anxiety, or if you had postpartum depression after a previous pregnancy, you might be more at risk this time around. So, how do you know if you're dealing with the baby blues or full-blown postpartum depression? Well, the baby blues are common. You might feel a little weepy, a little overwhelmed, but these feelings usually pass within a couple of weeks. Postpartum depression, on the other hand, is more intense and lasts longer. We're talking about feeling sad, hopeless, empty, even numb. You might lose interest in things you used to enjoy, have trouble sleeping even when the baby's asleep, or feel anxious and irritable all the time. Some women feel guilty because they think they should be happy, but they just don't. And that's okay. The important thing is to recognize the signs and get help. Now, I'm not a medical doctor, but I've worked with enough folks to know that getting a diagnosis is important. It's the first step to getting the right treatment. So, if you're experiencing any of the symptoms we've talked about, don't wait. Talk to your doctor. They'll ask you about your symptoms, your medical history, and how you're feeling. They might use a questionnaire called the Edinburgh Postnatal Depression Scale. It's a fancy name for a tool that helps them figure out what's going on, and they might do some blood tests to rule out any other medical conditions that could be causing your symptoms. Here's the good news. Postpartum depression is treatable. You don't have to suffer in silence. One of the most effective treatments is therapy. Talking to a therapist who specializes in postpartum depression can help you understand and manage your emotions, develop coping mechanisms, and work through any underlying issues that might be contributing to your depression. Medication can also be helpful, especially if your symptoms are severe. Antidepressants can help regulate your mood and give you the boost you need to start feeling like yourself again. But it's not all about pills and therapists. Lifestyle changes can make a big difference too. Getting enough sleep, eating a healthy diet, and exercising regularly can do wonders for your mood. And don't be afraid to ask for help. If you or someone you know is struggling with postpartum depression, remember that help is available. Don't hesitate to reach out to a healthcare provider. You're not alone in this journey. Postpartum depression is a common experience, and there's no shame in seeking help. Remember, you are a valuable and capable mother, even when things get tough. Thank you for watching, and take care.